You are watching McLaren-Port here on Today's Health, and today I'm speaking with Dr. Reed Stromberg, a primary care physician, about some common health concerns we are seeing in certain age groups and populations. Dr. Stromberg, now we're going to speak about our millennials, so those ages 24 to 39 about. What are the common things that you're seeing in that age group?
Well, obesity, early diabetes, hypertension are certainly risk factors and things that are coming up more frequently. Anxiety and depression is also a common complaint.
Are you finding that some of these conditions like diabetes, like that, is that as common in a young person as it was maybe 15, 20 years ago?
It's becoming more common. Lifestyle, certainly people are a little bit more sedentary than they've been. Access to poor quality food that's high in salt and high in calories, but low in nutrition is unfortunately common.
How often do you recommend someone in this age group to come and see you, like for their wellness visits?
Well, once again, it depends on their medical status. Certainly if they have no risk factors, they're healthy, blood pressure's normal, sugar's normal, pretty much yearly, if not every other year. With diabetes, it can vary from every 3 months to every 6 months. Hypertension, at least every 6 months.
So let's talk a little bit more about obesity. Can you kind of give us the explanation as to what it is? Because I know there's different classifications. Can you explain that to us?
Right, so obesity is defined as a body mass index of 30 or greater, and that's your height versus your weight calculated. Morbid obesity is 35 or greater if you have a risk factor such as high blood pressure, diabetes. Otherwise, if you have no risk factors, it's 40 or greater.
And why is that important, especially for this age group, to address?
Well, the longer someone's diabetic, the more risk they have to the leading causes of blindness, kidney failure, and amputation. Those are the 3 most common things leading to diabetes, and it's all based on how long you're diabetic for.
Yep, and then heart disease as well for someone with obesity?
Yeah, heart disease is 10 times greater in somebody with a diabetic than it is with someone without diabetes.
So how do you help your patients? I know everybody wishes for a magic pill to this, so it's a very complex condition. So where do you start with your patients?
Well, usually just yearly lab work or every other year, depending on their age and their medical history and their family history. A lot of that can detect the most common problems such as diabetes, hyperlipidemia, i.e. high cholesterol, hypothyroidism are all very common. Routine blood pressure management to check for hypertension.
And so with your patients that maybe need to lose some weight, where would you start with them? Where do you recommend diet modifications, or how do you start?
Yeah, lifestyle modification is the first choice and first recommendation for that, but it's not always successful. Some of the most well-meaning diets are the Mediterranean diet, which seems to work well for people because it tends to be high in fish and low in fried foods and sugary foods. Other things, including diets such as the Atkins diet, can also be beneficial for weight loss, although that one's difficult to stick to for most people. Sometimes people require medication for their diabetes or their obesity to help them lose weight, and there's a various group of medications for that. Unfortunately today, insurance companies either cover weight loss medication for obesity or they do not. There's typically not any gray zone, and some of the medications can be quite costly for people.
Are there other options or places that you can refer patients if they've tried to diet on their own and just need a little bit of extra support?
Yes, certainly a referral to a registered dietitian can help. They can customize a meal plan for that person and help them. Some people are treatment resistant and may go on to have surgery for their obesity.
So really, again, it's just monitoring those people and helping them throughout that course.
Yes, of course. It's very individual. There's no blanket statement for any of those diseases.
Yep. So let's talk a little bit about diabetes. That comes up as a risk factor in every age group that we talk about. Can you tell us why you're having a normal blood sugar level is so important?
Well, maintaining normal glucose decreases your risk of all the complications related to diabetes. Certainly if you're pre-diabetic, simply losing 20 pounds and increased physical activity such as walking 15 minutes 3 times a week might ameliorate that. and prevent you from developing diabetes. But once people are diabetic, they're typically considered diabetic for life. Even if their sugars normalize, we'd still continue to monitoring them, maybe not as frequently, but the hemoglobin A1C test gives us an average of what somebody's glucose has been over a 3-month period. That's a great test for that. Also, just a random blood sugar to tell us whether they're in the normal range, which, by the way, is 70 to 100 for a normal person. A diabetic, 100 to 120 would be considered controlled. Fasting, of course. Not fasting, if you've eaten up to 180, would be considered normal for both diabetic and non-diabetic.
Very good. So changing gears a little, for this age group, are there some vaccines that are recommended?
Yes. There's vaccine recommendations from everyone from newborn to 90, pretty much. For this age group, a tetanus booster every 10 years, with or without the pertussis. The tetanus booster is the TD, which is tetanus and diphtheria. That's recommended every 10 years. It's also recommended at 40, typically, they get the pertussis added back in because then we start losing the immunity to that. And while most adults would not necessarily develop a significant case of pertussis, it could be fatal to infants if you expose them to that. Also at this age group, so hepatitis A is recommended for anybody over 18. Hepatitis A is a foodborne hepatitis, and people are at risk if they eat out at all. There's certainly been some outbreaks in the past 5 to 10 years here in St. Clair County, in the city of St. Clair, and most recently in Detroit several years ago. In fact, when I was a medical student, there was an outbreak at what we should call the hepatitis deli, quote unquote, and I treated patients, and people died from this, which was quite surprising.
Dr. Stromberg, thank you so much for sharing this information with our audience.
It's my pleasure. Thanks for having me.
And thank you for watching this episode of McLaren Port Huron Today's Health. If you would like more information or to schedule an appointment, go to our website at www.mclaren.org/PH Family Doctor. To watch additional videos, visit our website at mclaren.org/PH Videos. This is Kelly DiNardo reporting for McLaren Port Huron Today's Health.